I'll quickly try to look at the anatomy of the next bone right here before us, and this is what is known as a nasal bone. Okay, so the nasal bone is just upward to that soft cartilage that you feel on your nose. So as you're feeling it and you're going up, and the first hard thing you feel on your nose here is actually what the nasal bone. Okay, so we call them nasal bones. Why? Because what? It is actually one bone, two bone, but they are the same. They are fused in the middle. Do you understand? So that's why we actually call them nasal bones. So they are too small. They are paired facial bones, and they form the bridge of the nose. They are situated in the midline of the face between the frontal bone above and the maxilla on the sides. For their shape, they are small, they are rectangular, they are flat bones. Their key features, we say that the joint upward with the frontal bone that's going up, okay. Then at the sides of the maxilla, at the back, they will join with the what? Ethmoid bone. Then below with the nasal cartilage. Okay, so what is that? Okay, still continue. Okay, surface, they are smooth externally. They form the visible nasal bridge that we always talk about, and internally they contribute to the nasal cavity. Okay, so this is what the nasal bone that we are actually talking about. So function is basically they form the upper part of the nasal skeleton. They provide attachment for the cartilage to shape the lower part of the nose. They support the nasal cavity structure. So the bone could be fractured when we call it nasal fractures, and it could also be deviated. It could also be displaced. Then most of the times, if you want to surgically repair it, they do a surgery which is known as rhinoplasty or septoplasty. Just to reshape the nasal bones in case they are deviated or malaligned.